All right. Good afternoon, everyone. Before I start, I want to recognize important folks who are very important folks who have joined me today. We have our Deputy Mayor for Equity, Health, and Human Services, Faith Leach. We have the Associate Director of Community Engagement Opportunity in the Mayor's Office of Neighborhood Safety and Engagement, Mr. Wesley Dawson, Dr. Margot Candelera, Research Associate Professor in the University of Maryland, Baltimore School of Social Work, and co-director of the Parent, Infant, and Early Childhood Program, and Kimberly Haven, Executive Director of the Reproductive Justice Inside. And we're also joined today, Tracy pulled a fast one on me, done by Tracy Estep from the Mayor's Office of African American Male Engagement. As I stated yesterday during the State of the City address, we are well positioned to double down on the progress that we've made to build a meaningful public health approach to public safety. A key part of that approach is ensuring that people who are incarcerated are not disconnected from society before and immediately after they are released back into our communities. We are here today to announce a huge steps towards making sure that incarcerated residents are reconnected to their families, their emotional support networks before they are released, so that they have the relationships they need to carry on their lives after they serve their times and do it in a productive way. I am proud to announce the launch of Be More Reconnects, a new program that will provide recently incarcerated parents with the support they need to maintain and strengthen family relationships. Relationships that are fundamental in preventing recidivism and preserving the full development of young people. I want to thank the U.S. Department of Justice, whose grant really helped bring this work to fruition, the Wright Family Foundation, the Richmond Family Foundation, and the Zanville and Elizabeth Krieger Fund for their partnership in this effort. Reconnects will provide proven research-based parenting education to approximately 400 parents in detention centers, as well upon reentry, with a focus on navigating and strengthening parent-child relationships, while also addressing the trauma that incarcerated residents and their loved ones face while they are behind bars. Working with correctional officers to re-examine visitation policies to allow for meaningful parent-child connections during visitation while maintaining safe practices as well. This program will prepare families for life after incarceration by investing in the coordination of services for these parents upon re-entry, including educational and vocational support, health care, housing, and parental support. Be More Reconnects is part of our reentry network that focus on the readiness and success of incarcerated individuals who are returning to our families and communities. A strategy that will also make our city safer by greatly reducing recidivism and strengthening family structures in Baltimore. We are a stronger Baltimore when families are stronger, and we will look after individuals behind bars and help them. When we do that and help them connect with the outside world, we advance our vision for Baltimore that is a safer place for all of us to live in. I can't wait to see this program up and running to continue our progress to an equitable and sustainable position and approach to public safety. Thank you. And now I'd like to turn it over to Deputy Mayor Leach. Deputy Mayor.
All right, thank you, Mayor Scott. Good morning, everyone. My name is Faith Leach, and I serve as the Deputy Mayor of Equity, Health, and Human Services, as well as the Interim Executive Director of the Mayor's Office of Children and Family Success. Today is a proud day for me, both personally and professionally. First, I get to stand beside our mayor and key partners to announce the launch of a grant program that will foster positive family engagement between incarcerated parents and their children. Second, I get to stand in my own power and purpose and tell the story of how the incarceration of my own parents impacted my life. And last, in this very moment, I get to be the woman I always needed growing up. I get to be the visible representation of what is possible. So it sounds like we have a lot to cover in just a few short minutes, so we can get right into it. Research shows that families, especially children, are the collateral damage of incarceration. Here's what we know. The Prison Policy Initiative estimates that about 80% of women in jails, including those awaiting trial, are mothers. 1 in 14 young people in the U.S. reported having experienced an incarcerated parent. Children with incarcerated parents have an alarmingly high rate of adverse childhood experiences, or ACEs. These young people are at higher risk for trauma and often experience re-traumatization when forced to navigate child welfare and other systems. And in Baltimore, an estimated 20,000 children have a parent who is incarcerated or on parole or probation. If having an incarcerated parent was classified as a chronic health condition, it would be the second most prevalent chronic condition in the United States for children under the age of 18, just behind asthma. That is why the Second Chance Act, addressing the needs of incarcerated parents and their minor children, is so critical. Through a grant program from the Office of Juvenile Justice and Delinquency Programs, the City of Baltimore, specifically the Mayor's Office of Neighborhood Safety and Engagement, with support from MOCFS and the Mayor's Office of African American Male Engagement, will work with the UMB Center for Innovation and Implementation at the School of Social Work to administer a program that will include engagement with incarcerated parents and prison staff to reduce trauma and strengthen parental relationships with their children. This 3-year project will work with local partners to expand services before and upon reentry, to promote developmentally appropriate parenting skills and provide training for correctional officers to safeguard children and families during visitation. Additionally, this project will examine visitation policies to make visits more family-friendly and support the delivery of community-based services upon reentry. I want to take a moment to thank the mayor for his visionary leadership, Director Shante Jackson, who could not be here with us today, the leadership and staff of the Mayor's Office of Children and Family Success, both past and present, who worked on this grant, the Office of African American Male Engagement, the University of Maryland School of Social Work, the Baltimore City Health Department, Pivot, OJJDP, and Reproductive Justice Inside, and so many other community partners. Now, I will end with sharing a story about the power of this work. Growing up, both of my parents were incarcerated for most of my childhood. My father lost his life while he was incarcerated, and my mother was in and out of prisons until I was about 16 years old. During their incarceration, I was fortunate enough to live with my great aunt, who ensured that I remained connected to my siblings, even though we lived in different cities. I was unable to visit my mom while she was incarcerated, in part because of how far her facility was from where I lived. But she called, and she wrote, and she sent photos when my siblings visited, all to maintain our familial bond. Now, here is my favorite part of the story. This is the part of the story that illustrates why the investments we are making in our reentry system are so important. After my mom was released, we began to rebuild our relationship. We began to reconnect. Today, she is not only my mother, she is my friend and the most inspirational human I've ever met in my entire life. And it took hard work, many, many years of hard work for us to get here. Upon returning home, my mom participated in a reentry program where she was connected to employment. She went on to work for that same reentry program for more than 20 years, and at age 60, she received her bachelor's degree. But that's not all. A few short years ago, at 64 years young, she got her master's degree in social work. My mom's story is why we can't ever, and let me repeat that, we cannot ever give up on our neighbors returning home. With the right investments and commitment, we can literally change the trajectory of people's lives and that of their families. This work is deeply, deeply personal to me, and I couldn't be more thankful to work for an administration that believes so much in the promise of all of our young people, especially the most vulnerable ones. Thank you again to all of our partners and to Mayor Scott.
Thank you, Deputy Mayor Leach, for that powerful testimony about why this work is important and why we cannot give up on anybody, especially those who have children and those families, and why investing in them will ultimately make our city not just a safer place, but a better place for humans to exist and live in. So thank you very much. I would like to now turn it over to Wesley Dawson, the Associate Director of Community Engagement and Opportunity in Muncie. Wesley?
Thank you, Mayor Scott. Good afternoon. My name is Wesley Dawson, Community Engagement and Opportunity Associate Director for the Mayor's Office of Neighborhood Safety and Engagement. I'm glad to join you all on behalf of Director Shantae Jackson. When I consider the folks who are here today standing in partnership with the Be More Reconnects initiative, I can't help but acknowledge how this is indicative of the coordination that is taking place in real time with Muncie and other city agency partners and community-based organizations like Pivot across the city. The ecosystem of opportunity that Pivot specifically has created for incarcerated women, mothers, grandmothers, and sisters to reclaim their lives and return to their families is crucial and in direct alignment with the work underway at Muncie. City government cannot do this work alone. We need strong partnerships with community-based organizations providing direct services. Pivot is one amazing example, and we could not be more excited about the partnership. We're proud to be able to provide support to this organization as their dedication to reentry embodies the Mayor's commitment to supporting individuals returning home from prison and to their families. Also, I want to uplift the Mayor's Office of Children and Family Success and the Mayor's Office of African American Male Engagement, because without their partnership, this work would not be complete. The Mayor's Comprehensive Violence Prevention Plan outlines the importance of ensuring folks who are or who have been incarcerated have all the resources they need to successfully return from behind the wall, and that they all are well equipped to support their families and carry on meaningful and productive lives. The Mayor has been clear that our reentry work must start long before Baltimoreans return home from prison. Muncie will be focusing on reentry in new ways as a city government. The work Baltimore Reconnects is one integral component of the reimagined reentry system, and we're building that right now. For starters, Muncie has hired Baltimore's first ever reentry coordinator. As the mayors mentioned yesterday during the State of the City address, we're also working to implement the Returning Citizens Behind the Wall program in partnership with the Maryland Department of Public Safety and Correctional Services and city agencies, which would train and employ residents to clean and green the city both before and immediately after their release at $15 an hour. Our team will also be working to develop safe home return plans, making sure we're helping eliminate barriers and fostering connections to each other's service providers. We know employment and connection to critical services is essential to make sure that residents returning home to our neighborhoods do not reoffend, return to prison, or find themselves unable to make ends meet. In the months ahead, we'll be establishing a Reentry Action Council to leverage the wisdom of people with lived experience, direct service providers in this space, and other experts as we work towards implementation of the programs and initiatives we've discussed today. Again, the work takes partnership and cross-community collaboration to ensure that families are not only successfully reunited, but have what they need to sustain the healthy family structure in the long run. Muncie is proud to work with Be More Reconnects and remains committed to returning citizens and their families alike. Thank you.
Thank you, Wesley. And I'll now turn it over to Dr. Candelara, Research Associate Professor at the School of Social Work and Co-Director of the Parent, Infant, and Early Childhood Program to discuss specifics of the program. Doctor?
Thank you. I'm Dr. Margot Candelaria, Research Associate Professor at the Institute for Innovation and Implementation at the University of Maryland School of Social Work. On behalf of the university, I want to thank the mayor and his offices for this partnership for the Be More Reconnects project, as well as the Maryland Department of Public Safety and Correctional Services, Pivot, the Baltimore City Health Department, and Reproductive Justice on the Inside, as well as our community funding partners. We are very excited to work on a project that will make a difference in the lives of children and families in Baltimore City. Our project primarily has three parts: offering parenting support services in the 6 months pre-release as adults are getting ready to return to the community, offering parenting support after they are engaging in community reentry services, and working to inform correctional staff to understand trauma and the needs of families that will inform improvements for visitation policies and practices. By working with parents in the months before community reentry and as they're reentering their community, Be More Reconnects will prepare them to have improved relationships with their children, which helps our city's children. We've already heard the statistics on this. Incarcerated adults are often parents, and if we support them to be successful citizens, we need to also acknowledge that they're parents, and we need to support those endeavors as well. We should remember that adults who have needs are often parents, and that we need them to support their kids, and they need help refostering relationships as they re-enter and reunite with their families. Be More Reconnects is going to spend the first few months of the project doing focus groups with incarcerated parents and correctional personnel to learn about specific experiences and needs. This will inform our specific strategies and ensure that we use an approach that is meaningful and appropriate. We will also be creating a community advisory board that will include parents who've been incarcerated and community partners, and this will allow the project to be informed by community members with lived experience. We believe it's important that adults are seen holistically, that when they get services for reentry, that includes services as parents as well, so that they're supporting the children as they're reunified with their families. Be More Reconnects will engage in carefully monitoring processes and evaluation over time to make improvements and ensure success. The Institute, the School of Social Work, and the University of Maryland looks forward to working with the mayor's offices, the Department of Safety and Correctional Services, and our community partners to serve the families of Baltimore City.
Thank you, Doctor. And last, we will hear from Kimberly Haven, Executive Director of Reproductive Justice Inside. Kimberly?
Thank you so much, Mayor Scott. I am proud to be here on behalf of Reproductive Justice Inside today, and I thank the mayor and all of his offices, all of our community partners in Be More Reconnects. You know, before I came up here, I kind of knew what I was going to say, and some of my other panelists have already said this. So I'm going to change what I was going to say. We've been talking about children of incarcerated parents. Well, I was the incarcerated parent of a child. And just because somebody is incarcerated does not mean that they don't want to be a good parent. It does not mean that they don't leave their parenting responsibilities, their anxiousness about what's going on with their children when they're behind the fence. I've seen women do the most incredible things in order just to maintain that connect. I have seen women give up going to dinner to be able to race to the phones, to call home so that they could help their children with homework. And when they didn't know the answer, they would turn to someone and say, hey, listen, my kid's failing algebra. Anybody here? And we would do that. I know parents who would call their children to read them a bedtime story. Those connections are critical when a parent comes home. They are critical for good, healthy childhood development. They are good for our families. They are good for our communities. I love my city. I truly do. And I love the fact that there are programs like this that has brought about such great cross-collaboration between the city, community partners, the Department of Public Safety and Correctional Services, to come together and to invest in parents, to invest in our children, to invest in doing things better. The idea that we can now support parents before they come home. Parents were cobbling together, and they're still cobbling things together in order to maintain those connections. Now imagine when we get this program up and running, when it's in place. Imagine how strong those family units are going to be. Imagine when mom or dad comes home and they can step easily back into that role of a parent and not have to try to run to play catch up. I am proud to be working now with the Department of Public Safety and Correctional Services on understanding trauma, on understanding what happens when we bring children to those visiting halls. They're doing amazing things to ensure that those parent and child connections are maintained. But they have a different mandate than, say, maybe I do. And that's okay. How do we work together to minimize, to alleviate some of that trauma? When visiting hours are over and the child has to leave with the caregiver, how do we create that safe space for that child to be able to process, mom's going this way, but I'm going this way? How do we work with moms? I'm not bashing men, I love men, don't get me wrong, but how do we work with moms so that when they leave that visiting, they're not also traumatized, they're not also rethinking and beating themselves up, but instead they are learning new skills of coping. COVID presented an interesting perspective for us. It's shown a bright light on things we were doing wrong, things that we could be doing better, but it also presented an opportunity for us to look at how we parent behind the fence. The program like Be More Reconnects is going to be critical in taking all of those lessons that we learned, incorporating them into individuals with the experience who are coming back to our city. And let's not mistake that. They are coming back to our city. They are our brothers, our sisters, our aunts, our uncles, our mothers, our fathers, our neighbors. These are all of our kids. This program is crucial. This program is going to have an immense impact on the lives of all of our communities across the state. And so on behalf of Reproductive Justice Inside, as a formerly incarcerated parent of a child, I thank Mayor Scott, his administration, and all of my community partners for stepping out and stepping up to ensure good, healthy family outcomes. Thank you.
Thank you, Kimberly, for that and for all that you do. And thank you, everyone who joined us today. And now we will take questions. Abijoy, looks like you're first.
So a couple of things for you here. Can you explain to us why a program like this didn't exist before? What are the roadblocks that's making it possible just now?
Well, I can't speak to why it didn't happen before. And I think what you're hearing and seeing here today is really about a new era of partnership between city and state government, but also our other partners that you see here today to have a deeper impact. We're looking at this issue in a much deeper way. As you heard from Kimberly, it's about taking the work that already exists further.
Mm-hmm. And when can we expect to see these programs kick in?
So I know we'll be working, as you heard from our good doctor about working with corrections going in there to get a good lay of the land, and we'll expect to be able to come back and let you guys know exactly when we're going to roll out. But I think all of the partners here would agree that when you're dealing with the incarcerated population and the impact that it has on their families, just running into it to just say we're starting the day without knowing exactly what's going on the ground and what people are feeling is the absolute wrong thing to do.
Okay. If I could speak with the Deputy Mayor Leash.
Yeah, you sure can.
I want to get an idea of your personal story and what was it like for you as a child with an incarcerated parent?
Thank you for that question. It's a complicated question. So, thankfully I still remain connected to my family. So as I mentioned, I grew up with my great aunt, but I was disconnected from my siblings. So on my mom's side, I'm the oldest of four children. On my dad's side, I'm the youngest or second to last of about 5 children. And so, it was that deep disconnection from both my father and my mother, but it was also that disconnection from my siblings that was difficult. But it was something that we all were able to navigate together. Mm-hmm. And what I will tell you is it informed and really motivated, me to do the work that I do today. Mm-hmm. It's why I'm so deeply committed to this work. And it's a huge part of who I am. And it's something that I really have just began sharing, I would say, over the past like 2 to 3 years, but it's because there's so many other young women and young men out there who have that same story, and it's really about showing what's possible.
You mentioned, someone up here mentioned the figure about 20,000 kids in Baltimore City. With that high number of kids who are being impacted, can you talk about the potential for stopping a negative cycle?
Yeah, so I think Be More Reconnects it's showing what's possible, right? We are piloting something that is innovative, something that can be a model for how we do this work across the country. And so we're starting out with 400 incarcerated parents and their children, but there's a possibility to really expand that work. And so, this work is really about showing what we are able to accomplish together, community partners and government and the federal and state government as well. And so while that 20,000 number is large, we still have the ability to really start to make that impact just with the 400 that we're starting with and hopefully expand the work.
Mm-hmm. But I think more specifically, though, I'd like for you guys to speak about stopping a negative cycle. If you're not growing up with a parent, a lot of research has shown that you may fall into a negative trap. Can you talk about that, Mr. Mayor?
Yeah, Abijoy, I think we know that the data is there, and this is why we're doing this, right? It's also on both sides, for the children and for the parents, right? We know that we have in Baltimore a history of recidivism. We know we have a history of young people who are the children of adults who were incarcerated, then becoming incarcerated themselves. This is about disrupting that, and you can't disrupt that without actually digging into those families, both parent and child. And this is a different way. This is something, to your earlier question, we probably should have done decades ago, but we didn't. But we're doing it now because we know that this will have an impact. These children's, their lives can be saved. We can work to make sure that their parents, when they come home, have the resources they need to deal with everything that they will, to make sure that they are in their best mental space, to make sure that they are healing and reconnecting with those families. We can see how this program can grow into helping us, but when you're starting with these 400 children, you're saying that we can help to save their lives, reconnect their families, and make our city a safer and better place. Thank you.
Dr. Margot, can I just ask 2 more questions? I'd like to speak with Ms.
Well,
Kimberly.
you got to come back.
Okay.
Mackenzie's been waiting.
Thank
Mackenzie?
you. I do have a question about the 400 children involved here. You talk about the idea to expand it. How long do you think it would take to expand the number of participants if we're looking at just starting with 400 kids? Do you have an idea of the timeline for that?
I think the good doctor would say that I'll be foolish to tell you that we know, right? We actually have to go do the work and see how successful, see what we are, learn. That's how we grow these programs, right? You grow programs by going out, doing the study, doing the work first, and saying, okay, this is how we can expand and do that responsibly. And this is something, Mackenzie, that you also have to just understand the connectivity across agency, across government lines, into the private and foundational communities. So this is just the appropriate way to handle such an important task.
Looking at the grant, it's a 3-year grant. Do you anticipate that the study taking longer to do to see how effective this is, and then perhaps needing more money to continue and growing? And where would that money come from?
What I'll say is that we are prepared to go through this grant and do the assessment and make the necessary resource adjustments in every way that we can, working with all of our partners to help us expand based on what we learn through this process.
Okay. And then if I could ask another question about this morning, the police confirmed the homicide of a 40-year-old woman who was shot inside of a home. There's been reports about kids inside the home at the time of the shooting as well. Do you have any information about that? This is the latest homicide victim, a woman, kids potentially involved. Any information from police about that?
So what I will tell you is what we shared publicly, that we had someone cowardly shot in her home, and that we're going to investigate it, and our detectives will track it down. We're not going to share anything outside of that, but we know that this family is now dealing with the loss of the life of a relative. Thank you.
I have one more, but I'll let Ava do it.
Go ahead. You can just get your last one.
All right. Okay.
Because, yeah.
Looking at yesterday when during the State of the City, you mentioned obviously the expansion of some community violence intervention ecosystems and talking about the violence obviously we're seeing play out. I just talked to a community member who was born and raised in Baltimore, and he was saying that this is becoming the norm in Baltimore when it should become a problem. And, more than 300 people have been killed for the last 7 years in a row now. Do you think that there was an opportunity perhaps missed during the State of the City to readdress your commitment to the 5-year crime plan, or perhaps tweak it and make that known to the public?
Yeah, Mackenzie, I think that you guys are infatuated with trying to make this so simple. So let me simplify it for you guys in the way that you understand. I am committed to violence, not just in a 5-year thing, but an everyday thing. But what we have to understand is that Baltimore has had 300 homicides a year, pretty much most of my lifetime. And we cannot say that in a way that makes us think that we're going to flip a switch and it's going to go away. We're talking about dealing with the both and, not either or. We're talking about a police department that is clearing 50% of our homicides, rebuilt relationships with our state and federal partners that were in the toilet a few years ago, making sure that we're doing innovative things like we're doing today, making sure that we're growing that community violence intervention ecosystem so that we handle violence in every way, so that our police have their responsibility, but also have the resources and the time to focus on what they are trained to do, not do everybody else's job as they've been charged with doing for so long, so that we build that relationship with the other parts of the criminal justice system, so that we're improving what's happening there, even in things that I don't directly control through the CJCC, that we make sure that we continue our great federal relationships, but that we also work with the community. When you think about the work that we're talking about here today, when you think about what we're talking about with community violence intervention, like the great work that the brothers at We Are Us are doing, it's about having all of us be digging into this issue that we will solve in our city together. Thank you.
Okay, so my final question for you guys, I'll cut it down to one. I want to get an understanding of what are the circumstances like inside the jails when children have to visit, because you guys did mention this is something that needs to be improved.
I'm sorry, could you ask your question? We were trying to figure out who was going to come up.
Sure. What are the circumstances like when children have to visit their parents in the prisons and jails? Because it was mentioned a part of this program will be to improve that.
Mm-hmm. I think that it has the potential to cause trauma. Like I said when I was speaking, the idea of when a child leaves the prison or the jail situation and they're going one way with grandma, a caregiver, and mom's going someplace different. How do you explain that to a child? How do you get the child to understand what's happening? How do you deal with a mother who has brought trauma with her into the prison that may have contributed to her incarceration? And how do you help her deal with your child is going someplace else, you're going here? And to talk to what you were just talking about, Mackenzie, about the violence. Mothers and fathers are worried about what's happening to their children. And the key to working through that is that engagement piece, that how do we support that parenting? How do we keep those lines of communication? How do we provide the skill set? How do we provide the training? How do we provide the programming? We have baby bonding. We have grandparent bonding. I probably misspoke on what that last one was, but grandparent bonding within some of our facilities. And those are critical programs. But those are not just for our citizens that are coming back to Baltimore City. This is also not something that just starts 6 months like our program is before somebody comes home. Let's prepare people to be parents when they come home, to their children. Prison is not normal. It's not supposed to be normal. And so how do we take an abnormal situation and how do we put the supports in place so that moms are reading to their kids, dads are reading to their kids, we're doing homework, that we are also engaging about authentically what we tell our children. I cannot tell you the number of times that I heard women say to their children, "Mommy went to college." So mommy was there fixing you cereal this morning and now she's in college. I've also heard mommy went to the Army. But again, they don't know what to tell their children. Programs like this can help that, because then we can learn how to talk to our children, how to talk to our other family members who are taking care of our children while mom and or dad is away. Those are the things that we need to address when we're looking at what happens in that visiting room, so that we don't have one of the hardest things to watch is a meltdown. And meltdowns happen because kids don't understand. So let's equip parents with how to help their children understand a situation that's not the norm.
Thank you.
Thank you, everybody.